I can see we have, representation from across New South Wales this morning, so this is great. So welcome today, and thanks for joining us to our webinar on restrictive practices authorisation and building the capacity of the New South Wales sector. My name's Jenny Klaus, and I'm one of the sector support consultants for NDS in New South Wales. So just before we start, I'd like to acknowledge the traditional custodians of country throughout New South Wales and recognise their continuing connection to land, waters and culture. And I want to pay respect to elders past, present and emerging. So just before we get going, as most of us all now are getting used to the webinar environment, I just wanted to confirm and remind people that you're all on mute. However, please use the Q&A chat function to ask any questions throughout the entire webinar. And we will certainly have lots of opportunity to get to those. We have structured today's session as a Q&A interactive session. So please make sure you ask questions as we go along, and there are no silly questions. Please feel free to raise what is on your mind. If we aren't able to answer any questions for whatever reason, we will commit to following up with those questions and the answers following the webinar, and we'll distribute those with the webinar. We are recording today's webinar, so it will be released with captioning in a couple of weeks' time. So to get started, before we get to our wonderful panel, just to put the context of why we're running these sessions, in the environment of COVID-19, it has brought about some significant changes to how we're living our daily lives. And for some people with cognitive impairment and behavioural support needs, managing the impact of these changes to both regular routines, but also restrictions on being able to see family, friends, and do your familiar activities has been significantly challenging. And one of the issues we've been hearing about from providers is the intersection between COVID-19, behavioural supports and restrictive practices. So as we're starting to see restrictions easing in New South Wales, we can only hope that this continues, but we do need to face the possibility that the restrictions might need to be increased from time to time, depending on the spread of the virus. And we're all going to need to adapt to a life where some things will remain changed for this foreseeable future. So to help us explore some of these issues, share some experiences of what's worked and perhaps what hasn't worked, we're joined by a fabulous panel of experienced behaviour support practitioners who'll be answering your questions today. But just before I introduce them, I want to acknowledge the support from the Department of Communities and Justice, FACS, and in particular, Jackie Astolfi and the Performance Improvement and Central Restrictive Practices team in helping to develop this webinar and engage our panelists. So here we have today, we're joined by Jason Delia. He is the Manager of Clinical Services at Kirinari Community Services. Caroline Cummins is the Executive Leader, Clinical Services at Mercy Connect. And Michael Caballero, he is the Specialist Service Manager at Life Without Barriers. So in addition to these significant roles with their respective providers, these panelists are also part of the Department of Communities and Justice FACS independent specialists. So collectively, they've had decades of experience in working with people with disability and providers to develop and implement positive behaviour support strategies and to consider, approve and review restrictive practices. They have first-hand experience of the impact of the current situation of COVID-19 and what that's having on people with disability, with behaviour support needs, and some of the challenges that that's been presenting. So welcome, Jason, Michael and Caroline.
Hi.
Hello.
So in order to keep the session as interactive as possible and to make sure we're hitting the mark in terms of questions and queries that you might have, we'd like to encourage you to ask questions via the Q&A chat function. But just to kick us off and to get people warmed up with the idea of the opportunity to ask questions, we've got a couple of polling questions. So they will come up on the screen. So have you seen an increase in behaviours of concern in the people that you're supporting due to COVID-19? And also, have you also seen any increase in the need to use restrictive practices as a result of the impact of COVID-19? So we'll give people some time to rate their responses. And the results are looking very similar to the workshop we ran last Thursday. Interesting. Okay, we've got responses from 80%, 82%, so we might stop it there and just have a look at the results. So in terms of if you've seen an increase in behaviours of concern, there's been an indication that there's been some increase, and sometimes that, of course, depends on the supports that you're providing. And have you also seen an increase in the need to use restrictive practices? So 76% are saying that the use has not changed, and 21% are saying that yes, there's been an increase. So we might now go to our panelists just to get some feedback on the results of these polls. So perhaps, Jason, we might start with you. What have you been seeing in your work that, is it consistent with the poll results?
Look, I think I'd have to go with the smaller sort of section of not really seeing any increase in use of behaviour support, or not behaviour support, restrictive practices. At first, there was that sort of confusion around organisations wanting to keep their customers safe and sort of reducing the access to the community, but that was more the unclear sort of unclarity around the restrictions. But yeah, I wouldn't say I've seen any increase at all.
Okay, good. And maybe Caroline, is this a similar experience for you as well?
Look, we've certainly seen a decrease in behaviours of concern, generally speaking, even though in some small areas there have been an increase, which would be expected. But overall, we've probably seen a decrease, which is really positive. In terms of restrictive practices, I think there's definitely been a decrease from what I've seen in the needing to use them. And I think that correlates with the reduction in incidents and behaviours of concern.
And can you just comment on just generally why you think that is? What's your observation?
I think, it's around maybe, I can only really talk about our particular experience, but some of that is around I think the design of the programs that participants are attending. Maybe environmentally they don't meet their needs. So I think this is going to be a great opportunity to look at, how do we change things into the future? But, you know, some of that, there's some issues around transporting people together. You know, I think there's a range of areas that this is, and there's smaller groups that they're, while we're, you know, operating, you know, programs from a home-based environment, it's a lot smaller. So, you know, that may have an impact as well.
Thank you. And Michael, in the last 6 weeks or so, what have you seen in terms of in your practice?
So we haven't seen much change in relation to COVID. The only change really has been, I guess, access to staff members, because they've been so busy in trying to prepare for anything that may be related to COVID, in terms of making sure that they're prepared to obtain any PPE equipment, making sure they've got enough supplies, all that kind of stuff. So if anything, it hasn't been due to behaviours as such, but it has affected the work of behaviour practitioners, because they haven't been able to have much access to staff to regularly follow up with any prior behaviour work. There hasn't been any changes for restrictive practices for us either. We haven't seen anything in relation to that. We've had staff being a little bit confused about the what if. And so we've just been providing some consultancy support around that, and directing them to the resources that are available, such as the NDIS Commission's guide around restrictive practices in COVID. But that's all we've been seeing.
Thank you. So we've just got some questions that have come in. So this first one, social isolation restrictions have been causing some behaviours of concern that haven't been seen before. However, there have been some delays in accessing a behaviour support practitioner. What should a provider do in this instance? Who would like to respond to that?
I'll go. I suppose it's tricky, and obviously Zoom and the other sort of video platforms are quite great, but I think at the same sort of side, there's a lot of people in the houses that are just trying, in literally people's homes, that don't have the luxury of having a laptop, let alone those sort of facilities too. But I suppose for us, it's just trying to maintain that sort of contact, whether it's phone, just somehow, just at least there's someone on the end of the phone there to talk to you. And I suppose for us, it's just trying to keep that contact together.
Yeah, great. Carolyn, do you have any comments about this one?
I think, you know, what Jason was saying is, you know, yes, we can still keep in contact, you know, with practitioners and get some of that support, you know, via other mediums. But I think things like making sure that there are good routines in place, you know, if we're seeing some, you know, increase in behaviours of concern, but having difficulty actually accessing a behaviour support practitioner, yeah, putting some nice, you know, making sure there are routines, making sure participants are really understanding what's going on, so we're communicating well with them. Those sorts of things I think are going to be really important in this environment.
And Michael, did you have anything you wanted to comment on?
Yeah, I think just extending on that, where you may not be able to get behaviour practitioners, it really is just about knowing your clients well, and knowing and making sure that you're educating them and keeping them informed as much as possible in the communication methods that work for them, and making sure that you really think and plan about your week and what your week's going to look like, and structure it with activities that are of interest to them, that they're able to continue to communicate with people that are important to them via other means, making sure you've got the technology. If you don't, the NDIS has enabled people to purchase some like iPads and things like that to enable communication. So make sure you do that if you don't have that. Just trying our best within the current context to keep people connected, to keep people informed and updated, and trying to plan and structure their week so that they have things that are of interest and important to them still in their lives.
Yeah, it's important. And these iPads have been great, haven't they? Thanks, Michael. We have another question. Whilst implementing directions to quarantine or self-isolate when directed to by health are not considered restrictive practices, providers are concerned about some emerging grey areas. For example, is it okay to lock a person with a confirmed diagnosis in their room if they are unable to self-isolate? How have you responded to these sorts of queries or concerns when they've come to you? Who would like to start off with that one?
All right, you go, Caroline.
I haven't actually had, thankfully, any queries directly related to that. But I suppose, whenever I think there's often grey areas when it comes to restrictive practices. And I think it's really about pulling it apart and, really getting to the nuts and bolts of it. So, for example, in this scenario about locking a person in, well, depending on what the context is, but what benefit, if that's in a group home, what is actually going to be the benefit? Obviously, we wouldn't be advocating for that anyway, but even if you were to think about it, what's actually going to be the benefit of that when they've probably been with their co-residents, etc., while they were asymptomatic, etc. So I think it's really breaking it down and looking at, the implications for the person, for the people that they maybe, work with them, for their support networks, and, looking at what the other options are.
Great, thanks, Carolyn. Jason, did you want to?
Look, I'd say I agree with Caroline. I think also that there's other people living in the house too. It's as Caroline said, how do they protect themselves also? But yeah, I haven't thankfully come across a question like that. The only similar questions I've sort of had is around the early days of the social isolation and houses wanting to protect their obviously customers. So therefore, locking the house down. But then at the same sort of side, there's been no requirement by the medical officer that anyone's is positive. So there's that trying to balance, okay, what can we do? We can still go for a walk, but, away from others. So it was more just working with that sort of group home, how to keep the customers safe, but also at the same sort of side, not having any restrictive practices in place.
Great, thank you. We have another question that's come in. So providers are wanting to be proactive in terms of preventing behaviours of concern escalating or in some cases developing. Are there practical strategies that you've seen that have been working well?
Yeah, so maybe I'll go first. So we have done this at Life Without Barriers, where we were wanting to be proactive in terms of making sure that we inform our customers of proposed changes that were occurring and what was likely to occur differently within their environment if there was a confirmed case or a suspected case, and what changes would be occurring within their home as a result of that. Because one of the things that we're foreseeing is that if there was a change within, we've already got a change within people's environments in terms of their restrictions to community, so not being able to go to their community programs, being in groups, etc., stuff like that. But what happens if staff are needing to start wearing protective gear? If they're coming in with aprons, face masks, gloves that aren't usual practice, could that potentially present with some anxiety in the people that we're supporting? And so we've actually developed, and there has been resources thrown around in the community in relation to social stories to help explain this concept in terms of, one, what is coronavirus, how does it spread, and what are the safety precautions for that? And then we extended that to be specific into our SIL homes in terms of what that might look like. We've provided some examples, so that would be implemented within all our homes, so that if that change were to occur, say tomorrow, somebody suspected to have coronavirus or is a confirmed case, then at least they've got that prior kind of knowledge that they can use to make sense of what changes are occurring within their environment. So that's something that we've done. We've implemented it across our region, across all of our services. And we were thinking that maybe that was a reason why we haven't seen an increase in behaviours, but it seems to be quite widespread that there aren't too many increase in behaviours of concern in relation to COVID. But we haven't had a confirmed case yet within our region, at least. So we haven't been able to see whether or not that makes a difference or not, but it's something that we're just doing to try and be proactive in this space.
Thank you. Did anyone else want to say anything about this question?
Yeah, no, I've got nothing to add. We're very similar on the same sort of track as Michael.
Yeah, I think just further on to, you know, what I was saying before about, you know, maintaining good routines for people. I think that helps them, you know, have a better sense of safety, you know, in their environment, being creative, keeping people as active as possible while maintaining, you know, those sort of restrictions and social distancing, etc. You know, I think it's about being a bit creative. So I think that can help. You know, keeping people engaged and active is going to help reduce, you know, the emergence behaviours of concern, hopefully.
Thank you. And just a reminder for people to send your questions in. I did miss a comment from Jasmine. This was a little while ago, Carolyn, in response to your comments about why there was not as much restrictive practices being seen. She says, I agree with Caroline. I think the decrease of restrictive practice is due to less community access. We stopped groups as well. Yes, and it is interesting, the outcome of changing routines. So we have another question. Where people with disability have had difficulty in managing strategies such as increased hand washing, social distancing, for example, how have you seen staff support people to engage in this? So some good practice examples. Has anyone got any you'd like to share?
Yeah, so we've certainly looked at using a lot of signage around our group homes as well as around our offices, you know, getting staff to really model what we're wanting participants to engage in. We developed, as Michael sort of talked about, a booklet aimed at participants sort of in an easy English format to explain, you know, what is coronavirus, you know, what are the ways that they can, you know, what are the implications of maybe getting, you know, coronavirus, and it's not necessarily something we have to be scared of as long as we, you know, take certain precautions, but then also it goes through the hand washing and all those steps that they can actually implement to make themselves safe. So I think a lot of that sort of thing, again, that communication, social stories, and the modelling by staff.
Yeah. No, I agree. The modelling by staff, I think the staff I've noticed now or done an amazing sort of job. Just where one person hasn't worked with one process, they've sort of tried in different ways, whether it's sort of soap or different types of soaps and smells, and some they're focused on the actual the sensory sort of side. Just they're sort of trying to get those customers involved in that sort of process.
Yeah, so we've been doing exactly those things as well. We've also used video as well to assist. We've just found some on YouTube, for example. And we've also did a little, so one of my behaviour practitioners shared a strategy in terms of using experiments to help explain how hand washing works. It was quite smart. She, it's just you get a bowl of water, you put some dirt in, and you add the soap in, and you see the dirt move away. And so it's a real kind of visual example of how the soap and disinfectant can remove the virus from your hands. And I really like that because it really reinforces the importance of using the soap and why we use it, because it will actually get rid of that. So that was a nice thing. So that was about her being a bit creative with that. She worked with children in her past role, so I'm assuming she probably picked it up from there. But it's thinking about all these different clever, creative ways in which we can get that message across to the people that we support.
Lovely, thank you. And this just reminds me, Jackie Astolfi from Fax has sent us a number of resources, and I think by now many providers will have sourced the tools that they can get their hands on, but we will distribute some of those really good resources, and they're from all over Australia, so that might be useful at some stage. That will come out just after the webinars. We don't have any more questions at the moment, so we might go to another poll and encourage people to ask some questions while we're doing the poll. So, and this is a multiple choice, so you can choose whatever. What has been the most challenging aspect of supporting people with behaviour support needs to adapt to COVID-19 life? So you can indicate as many as you like on this list. So we've got up to about 60% of participants on the line has voted. We might just wait for a little bit longer unless it stops, and that might mean we can, oh, we're still going. So it's only letting people choose one option. So maybe that's the problem we're having with the poll. But anyway, we've got close to 75% who voted. We just might give it another few seconds. Okay, we might call it there. So these are the results. Managing increased anxiety around the situation has been 23% experience. The biggest issue is needing to introduce new or change staffing arrangements. 48%. That has been a real standard observation that many providers have made to NDS. They've really stuck to trying to get certain staff on regular shifts in one house, for example. 16% adjusting and adapting support regimes, and 10% managing questions and concerns from families and carers. That has taken quite a bit of time from providers as well. So thanks everyone for giving your responses to that. So as we can see from the poll, some providers have found implementing or maintaining positive behaviour support strategies challenging in the current environment. Do any of our panellists have any suggestions or advice?
I'm happy to start off.
I was getting there.
I was trying not to be rude and jump in.
Thank you, Carolyn.
Look, I think I'm going to go back to the communication. I'm sorry, sound like a broken record, but I think that's so important, whether it be, managing anxiety of participants or family members or even staff. I think having that regular communication, those regular updates about what's happening, I think that's vital. And obviously for our participants in a form that they can understand. So I think that's really important. And again, whether it be around the changes to staffing, because yes, we've had to do that too, change rosters, and that can be, really unsettling for our participants. So it's about really explaining, having lots of visuals to be able to show them what the new rosters are going to look like, so they've got some sense of certainty, and even for, I think, families, understanding what's going on, etc. Because I think that's has been one of our main challenges around that, adjusting the new rosters, to reduce the spread of staff working across different outlets. So that's been a really big one, as well as the adjusting to the new routines that participants are engaging in now. And so again, you know, incorporating those visual routines, lots of communication, you know, thinking outside the square. I really like the idea that Michael, you know, one of his behaviour support practitioners had using video. I think that's, you know, that's a great idea. So having a range of mediums to really explain, and regular, I think it's not just once, but I think we have to keep that communication going throughout, and that's one way to manage those anxieties, etc.
Lovely, great. Thanks, Caroline. And Jason, were you doing?
I think also, I suppose it's probably what Caroline said in totally different words, but I suppose, you know, working in a group home is an isolating experience as it is for the support staff. So I think also it's making sure those staff are up to date, that the communication happens quite frequently about what's expected, what's required, and with the changes. It wasn't exactly something we could sort of plan and transition into. Like other times we had that sort of luxury. So it was that sort of sudden come to sort of change of the circumstances and what's expected, and but at the same sort of side, we're trying to maintain a consistent environment, which is far from it.
Thanks, Jason. And Michael, did you have anything to add?
Yeah, so it's pretty much the same. May just be a bit of an extension, because when we look, if we're thinking about implementing and maintaining behaviour support strategies, staffing is very key in that. Making sure that they are consistent, that not in terms of their approach, but also that the staffing themselves. As we know, in this environment, with the COVID, there is a lot of fear around the virus and whether or not there's a suspected case within the environment. How are we supporting our staff, you know, in relation to that anxiety that they might be feeling about coming to work where there may be COVID and what implications there may be there. So it's about talking to our staff, listening to our staff, understanding what their fears and concerns are, and seeing what we can do as implementing providers to best alleviate those fears as much as possible, to provide them with as much information, as much as equipment as we need, as much as possible, to help make them feel safe, to help alleviate some of that anxiety, so that they can be there in that environment to support the people who really need them, to have that consistent environment. So we've got to work with all people here. It's not just thinking about the client. We've really got to think about the staff, because they're very key and paramount to ensuring that we maintain any positive behaviour support strategies that we have within that house. Bringing in new people is going to disrupt that. If we're having to get agency, if we're having to get other staff coming in, that's going to disrupt that. So we need to try and keep that environment as consistent as possible, and we have to look after our staff to do that.
Thanks, Michael. And it's such a great, you know, COVID-19 has brought about some real difficulties, but also some great, it's brought us back to what the really essentially important things are, and including staff's support is one of those, I think. So we have another question. What does balancing dignity of risk and duty of care look like in this current situation?
Look, I want Caroline to answer that one first.
Thanks for that one, Jason.
No, I suppose for me, in a general kind of way, there is that, I suppose, what's required, the risks, the legislation, all those sort of things. But at the same sort of side, I mean, on one sense, you know, we don't have to stay at home. We're allowed to go in the community for exercise. So I suppose going in the community exercise, yes, to maintain that. But at the same side, you're sort of not stopping to shake hands with the person you come along with also. You maintain that sort of distance, just trying to get it sort of right, allowing what's allowed, but at the same sort of side, keeping people safe. I suppose that's how I could say answer it in a general kind of way.
Yeah, I think it's about not, I guess, I think it comes back to fear as well. And because that can drive our duty of care to a point where we become too risk averse, where we are trying to keep them safe, trying to keep them contained in order to you know, make sure that their health and well-being, their health is safe, but we've got to also think about their well-being as well. And so we've got to really make sure that we're always up to date with what the health is actually telling us. the Commonwealth in terms of what the rules are around what we need to adhere to, and make sure that we don't become overly restrictive in terms of what we're doing because we're thinking we're doing the best to care for our clients. We've got to make sure that we're still able to do all those other things that we can still do, because if we be too restrictive, then we're probably going to end up with behaviours of concern as well. So we're going to end up on that other end of the spectrum. So whilst we still have some freedoms to do things like to go out and exercise, you know, we should be doing that as much as possible, going out to the park, going for a walk, going out for a drive if we can, and not just staying confined at home because the fear of going out may result in somebody getting the virus.
Thanks, Michael. So I'm not sure if it's in response to what you've just said. I think it might be Michael, but we have a question from Vanessa. She said, are you starting to reintroduce groups? And if so, what are the practical strategies to reduce transmission? Are you screening people? And how do you ensure people are physically distancing? And what does the screening look like?
So I know within Life Without Barriers, there's quite a few different regions, and each region is doing something a little bit different. Some are doing a lot of screening of staff before they're coming into work, checking temperature, things like that. But in terms of groups, our lifestyles, so that's our community programs, haven't really opened up yet. We do have a lot of advice coming around from national in relation to how we're going to do that. So we're not just going to rush into things, we're going to take a planned approach, and we're going to then basically fade that in terms of how that looks. I haven't yet seen what that looks like yet, and I don't think we've moved there yet because it's only just recently those restrictions have been lifted. So I know that we don't want to rush into something. We're just trying to be a little bit careful and plan how that's going to look, and making sure that we engage with all stakeholders in relation to those decisions, because we've got families and carers that we need to consider as part of that. So it's not an easy answer, that one, and it's still something in development. And I think you know, it's just about that consultation process and making sure you come up with a good plan in relation to what the advice is of the health department.
And Caroline or Jason, would you like to add anything?
Yeah, we'd be much the same. It's just that sort of one-on-one consultation with the family, the accommodation staff, whoever's the key people, and that sort of gradual. We have a large space at one of our sort of sections, areas, so it's quite beneficial, that large space, but it's been more of a gradual, just to sort of bear in mind that sort of space and what's available sort of thing.
Yeah, and I think certainly we're taking a similar approach to Michael in being really cautious. So while we're starting to think about how we might start reintroducing groups and, you know, what that might look like, and we're sort of starting a bit of a plan, we're going to take it, you know, we're going to err on the side of caution, really, because again, you know, like nationally, we don't want sort of to put participants or staff, you know, at risk and, you know, open up too early. But certainly things, I know some of the strategies that have been talked about are, you know, within our group sort of activities are things like staggered start times. So there are sort of less people, you know, starting from a particular centre, etc. Those sorts of things. But we are developing a plan now about what that might look like, and whether it be, you know, certain days for certain groups and all those sorts of things we're doing, but we're certainly not going to rush into it either.
Thank you. Just on a similar but different tack, we've heard that there are some people who are actually enjoying the isolation and certainly have enjoyed some, you know, more one-to-one interaction, and perhaps thinking that might be the new normal, and you know, what does that mean for their life going forward? So I've just got this question. We have had feedback that some people with disabilities have thrived under the new support arrangements that have been put in place. Is this something that you've heard of as well? And what do you think some of the implications of this might be as we all start to return to a new business as usual state? Would anyone like to comment on thoughts about that?
Look, I will, but I probably don't have much to add. I suppose with that, if some customers enjoying the social distance, I don't know whether it also forces us to go back and review, you know, the whole what's important to the person versus what he is. You know, does a person actually like going at the community, or do they want to stay home? I mean, so I suppose it goes back to the individual, what they actually want. I mean, yeah, there's an expectation. I don't know whether they have to leave the house in the morning, come back at night time, go to some centre or whatever it is, or do they want to do it? Or it's just expected, but at the same sort of side, what do they actually want, like, enjoy?
Well, let's hope there'll be more consultation about that. Interruptions.
Yeah.
Yeah.
Yeah, look, we're certainly taking this as an opportunity to look at, because we've done some data analysis around, you know, what's been happening since we've sort of had a bit of a lockdown with, you know, stop the group activities, and people are sort of staying at home a lot more. So we've done a little bit of analysis around incidents and that within our own organisation, and seen a significant decrease in behaviours of concern. Because I was just curious to go, has there been an increase in self-harm maybe, as a sign of, you know, that level of anxiety and that around what's been going on? And while yes, there has been a slight increase, there's definitely been a very significant drop. So that's made us want to do a little bit more work around that, and deep dive a little bit more into going, well, what is it? What is creating that positive effect? So, you know, is it around the way things are structured? Are there less, you know, that push in the morning to have to be ready by a certain time for transport? You know, look at the different components that are actually contributing to there being less behaviours of concern, and then hopefully redesigning our group programs, or, you know, those day activities that people are engaged in, and think about how we can do them differently. So it's been a really great opportunity to collect that data, to maybe make some changes. So that's what, you know, we're certainly hoping to do.
That's fantastic. Be very interesting to see. And Michael?
Yeah, look, I think Caroline's hit the nail on the head there, in that one of the things that we do tend to see in our work as behaviour practitioners is the impact of different environmental contexts on behaviour. And you find that where there's a lot more demands, where there's much more sensory inputs, where there's much more busy environments, you might find that there's an increase in behaviours of concern. And, you know, we're still kind of operating in this pre-NDIS world as such, in where we have our, you know, we have our homes and we have our community programs, and that's just been the norm for a long time, you know. But since NDIS has come out, we've started to see a shift in that. We started to see some creative ways in structuring programs for the people that we support, that's a little bit more individualized, that tends to meet their needs more. And, you know, and I think the COVID environment is going to help push that a lot further. And we may need to really think differently about how we structure our programs for the people that we support, in order to better meet their needs, and not think of the way that we did things traditionally, but think of different, more creative ways of how we might structure those programs to create a better experience for the people that we support. But I think that's what it's communicating to us. It's communicating that, you know, now that they're staying home and they're not being going to these environments, and we're seeing a decrease in behaviours, well, then there's something there that's telling us that something's not working well for them. So we've got to think differently, and I think that's where we need to be careful as well when we're looking at transitioning back to this new business as usual. If we go back to the previous business as usual, are we going to then see possibly an increase in behaviours? So we've got to be mindful of that, because if we've seen a decrease when we stopped, we may see an increase when we go back. And then again, that will be sending another message to us that something's not right there and we need to think differently about how we structure that.
And can I just add something to that, Jenny? This has been something that I think our behaviour support practitioners probably had a sense of for quite a while, that the environments haven't been meeting participant needs the way they're currently structured. But it's been really hard to be able to collect evidence around that previously, pre-COVID. So this, unfortunate event, if we're going to look at, taking a positive from it, I think it's given us that opportunity to now be able to, see, well, what's a different structure, how has that impacted on participants and their quality of life, as in relation to behaviours of concern, etc., and how much more settled they actually are, and then going, well, okay, so, that's really supporting our hypothesis that, the environments as they were really not meeting people's needs, and now we really need to take this opportunity to be creative and look at how we can do things differently, to hopefully keep this trend going.
Good. Thank you, Carolyn. We don't have any more questions that have come in. So perhaps I might offer to any of our panelists to offer any closing remarks or comments that you think we haven't asked about, or you want to, put on the agenda for people to be thinking about. I mean, you've offered some really great insight to your current practices and thoughts about the data. That's been great. But any final thoughts?
Look, all I can sort of say is obviously this time has been quite challenging with the coronavirus, and I think in a lot of ways we've sort of worked in a way to sort of reduce those sort of challenges. But the same sort of side for me, I find, just as a practitioner, I think the greatest thing is not having that face-to-face. When you get a new referral, say for example, you want to just go and meet that person, start building that relationship, which can't be done on a computer screen or a television screen, whatever. I find that's the greatest thing, is regardless of how much we've sort of managed to sort of meet the needs of this coronavirus and communication, I still think there's that face-to-face for me, I think is the hardest thing to come across.
Thanks, Jason. Any other final comments?
Yeah, no, look, not really. I think it's just been while that is a challenge, and, being able to, do face-to-face observations and actually build rapport with the person is crucial, for behaviour support. I think it's also opened up opportunities about just thinking about how we can do things differently. And even if it's around training staff, can we do, sometimes it's more time effective, depending on, what training you're actually doing, but doing some sort of a meeting like this, so I think it's also opened up sort of new ways of thinking.
Great, thank you.
Yeah, I'd just like to do a shout out to all the staff that are out there, supporting our clients in this environment. Like it must not have been easy, in terms of, like I know a lot of people have been worried about contracting the environments and the virus and how easily it spreads, and thinking about your own families and things like that, but still having the courage to get in there, go to work, and to support our people who can be quite vulnerable. I think it's a massive thing that that I'd like to give that shout out to them, and thank them for all their hard work and being creative as well in their space. I mean, we're seeing a reduction in behaviours, but it's not just the environment, it's also the way that the staff are working with our clients and supporting them during this time. Great work, everyone, and keep it up.
Thank you, all of you. So we might close the session here. Just to say thank you, everyone, for joining us today. It's been great to see some of those pointy questions, and we hope that you found the session useful. A huge thank you to Jason, Carolyn and Michael for joining us today, and to the team from the Department of Communities and Justice, FACS, for helping to organise the session. So thanks and farewell to our panellists. We'll close off now. Thank you. And I'll just close with the last screen. Oh, no. Karen might be able to do that for me. But we will just for your information, we will be repeating this webinar on Thursday with another set of panellists. And there are still some places left in the session. So if you know any colleagues who'd like to jump on, please let them know, direct them to the events page on the NDS website where they can register. In the meantime, thanks again for joining us. And yes, I'll finish with Michael's shout out, keep up the good work. Thanks again.